Hello everyone, welcome to You Were There. In today's episode, we're taking a trip to Kagoro in Kaduna State. Why? To share God's love with a community in need. I hope you're ready because the bus lives now.
The CBN's Operation Blessing team is getting ready for another medical outreach. Finally, the mission is on the way and the destination is Gorok, also known as Kagoro in Kaduna State, northwest of Nigeria. The countryside flies by, revealing lush green woodland vegetation. And 4 hours later, the team arrives Kagoro. Over 20 volunteers have come in from across Nigeria, ready to serve the citizens of Kaduna and other states. Their commitment to service has created a bond of friendship that has lasted for many years. With a population of about 77,000 people, Kagoro is one of the major towns in Kaduna. The people here are mostly subsistence farmers and hardly make enough to take care of most of their health needs. So the visit of CBN's Operation Blessing means they will have an opportunity to access good quality health care for free. There are 2 venues for the medical outreach. One is at the Comprehensive Health Center of Ekwa College of Health Technology, and the other is at the Turaki Boga Memorial Hospital. At the Comprehensive Health Center, while the team offloads drugs and consumables, a pastor offers prayers for the success of the medical outreach. Elisha Dokyong, leader of the CBN's Operation Blessing team, talks to the crowd on what to expect over the next 5 days. While this team is getting ready, Timothy and his crew move drugs and consumables to the Turaki Boga Memorial Hospital. For hours and days, the Operation Blessing team will work tirelessly to bring the love of God to them.
No matter the distance or terrain, CBN partners are always ready to show God's love to those in need. The people of Kagoro seem eager to receive their gift of love. Let's not keep them waiting.
It's the dawn of a new day, and it's breakfast time. The volunteers are fueling up for a busy day ahead. It has been a satisfying event so far, and much work lies ahead.
It's a rainy, cold, and beautiful morning here in Kagoro town of southern Kaduna State of northern Nigeria. And the people have received this kind gesture with so much joy and excitement because they can't wait for a lasting solution to their health challenges.
At the eye clinic, Dr. Ugochukwu and other specialists look for answers to the eye challenges of the clients. Dr. Abimbola and her team examine the patients, prescribing drugs for some ailments. Some others get references to the lab for investigations, and those who need surgery have a team of experts waiting for them. Hard as it will rain, the people are willing to wait their turn to receive their medical treatment. The 700 club partners who sponsor our humanitarian interventions have provided a lot of drugs for this mission. The beneficiaries have access to some medications which would have been inaccessible to them at local drug outlets. So far, it has been a long, fulfilling day. A lot of patients have received treatment and a lot more are yet hopeful that as the first day comes to an end, they will still have their turn with the medical team. Nigeria has one of the highest population growth rates in the world, and maternal and infant mortality rates are equally high. This is mostly seen in the rural areas where access to healthcare is difficult. So the CBN team came ready to provide basic checks on the pregnant women and vitamins and other dietary supplements for the lactating mothers and their babies.
I am 5 months pregnant. This exercise has given me so much joy. I am happy with the care and attention I got. Thank you for the drugs you gave me for free.
Before CBN visited our village, we used to buy drugs only when we have the money. But today, we were giving drugs for free. I am so happy. I will make sure I take my drugs every day until the time of my delivery. Thank you.
I am 6 months pregnant. I am happy with the advice they gave us as pregnant women. We were taught how to care for ourselves and the baby in the womb. Thank you for the free pregnancy drugs. We are grateful. God bless you richly.
Ladi Monday and Beauty Timothy live on the Kagoro Hills. There are no basic healthcare facilities up there. So this visit by the CBN team is an opportunity for them to get treated and for free.
I live on the Kagoro Hills. When I heard doctors were coming to treat people for free, I got up very early in the morning and descended the hills. I find it very difficult to walk without support, but God made a way for me. I was diagnosed and treated for free. I have also received drugs. Thank you.
When we heard doctors were coming, we knew we couldn't miss this opportunity. God really helped us. We have received medical care and now we feel good. Thank you.
Little Ilya has been diagnosed with appendicitis and must have surgery quickly. The team moves him to the theater where the surgeons take over. A little while later, Ilya is in recovery and will soon be ready to return to school.
How can you say you love God whom you haven't seen when you can't love the brother or sister you can see? For Ladi, Beauty, Little Ilya, and so many more in Kagoro town, they saw God through you. Thank you, partners, for letting your love shine through in the darkest situations. God bless you. With your giving, you are transforming lives and communities. Now, who are these partners? Why do they do the things they do? After the break, you'll get the chance to meet one of them.
From tough terrains to deep waters, bringing hope and laughter to homes and communities. Thank you, CBN partners, for helping Martha, who is almost going blind as a result of cooking over smoky fires. She had no hope for a better life until CBN gave her a pair of glasses and a brand new business. Now she can look forward to a bright future. The people of Buckinriga village are also grateful to CBN for digging a brand new water well right at the center of their village. Now, the days of lack are over. Thank you, CBN partners, for putting smiles in people's faces.
My name is Patrick Otoro. I am a theater director, actor, and producer. I'm also a communicator, by the way. The one thing that keeps me going, really, is creativity. I just love anything creative. I'm not a regular person, so I love to do things kind of differently. I like colors, I like variety. That's why drama for me stands out in life, really. And I'm also a partner with 700 Club. I love the community works CBN does. There was this community CBN visited. They gave them borehole. I saw the faces of the people in that community. You could see sheer joy. When I see those pictures and I see what CBN is doing to alleviate the pain and the sufferings of those people, I cannot but thank God that my little support is helping to meet somebody and take them out of pain, to take them out of sickness, take them out of poverty, feed them. And amazingly, it's not about how much, no matter how little it is, just give it. Join CBN today and be a partner.
Thank you, CBN partners. Your gifts of love are touching lives all over Africa and beyond. Because of you, a widow gets the skills to save her family. Because you gave, an orphan is saved from the streets. Because you didn't look away, a thirsty community gets fresh drinking water. Because you chose to partner with CBN, a community like Kagoro gets the health care they need. If you don't join us, we might not be able to reach more widows, more orphans, more families, more communities. So we're asking you to partner with the Christian Broadcasting Network so we can take this message of hope to the ends of the earth. And you can start right where you are. With a monthly donation as low as 1,000 naira, you can begin. But if you can give more, we can do more. We have different partnership levels all the way to 84,000 naira monthly. Just log onto our website, click on the partnership form, fill it, and choose the partnership level that suits you. If you'd prefer to talk to us in person, just call any of the numbers scrolling across the screen. We can't wait to have you join us. It's been 3 days already since the CBN team landed in Kagoro. They've been hard at work attending to the medical needs of its people. But the residents in surrounding communities have been trooping in, hoping to get a taste of God's love. Now, while that is going on, Love, my producer, decides to meet them right where they are, at the very top of Kagoro Hills. Let's see how that went.
It's a chilly morning here in Kagoro town. Right about now, the team is set to go up the Kagoro Hill where a lot of people came from to be a part of the ongoing medical mission. So our curiosity won't just stop until we find out exactly what it took them to get here.
The Kagoro Hills, known by the locals as Afang Ogwarok, have many secrets that only the locals can reveal. One reward for the effort so far is a wonderful view of Kagoro town from the hills. While we walked up the hills, the Operation Blessing team is still at work, treating those in need of medical attention. This man and his son are on their way to receive the free treatment that OB offers. Going up the hills is no mean task for visitors. An hour up the hills and the hike is already telling on me.
Need some glucose!
There are different features that mark the progress of the travelers. Going through this narrow path is like the first rite of passage into the warm hospitality of the Gwarok people up the hills. Standing about 1,246 meters above sea level, this mazy wonder provided home and sanctuary to the Gwarok people for hundreds of years. It was a daunting obstacle to invading enemy warriors. The hills ensure a very clement weather that attracted European missionaries who settled in the present-day Kagoro. The missionaries brought Western education, hospitals, and the gospel of Jesus Christ. There is no lack of water on the hills. The women come here to wash and fetch fresh natural spring water for their domestic needs. The wonders of Kagoro Hills are inexhaustible, from the captivating rock formations and views of the town to the refreshing feel of this misty mountain. The locals refer to these as the second gate, and this is the passage into the villages on top of the hills. Finally, we arrive at our destination. African communities have a universal tradition of hospitality. We know we are in good hands as our hosts provide fresh drinks and light a fire to warm us up. Laraba Aliyu has lived here most of her life. She, Emmanuel and John, tells me about life on the hills.
Damuwar mu a dutsen shine mun gina asibiti amma ba ma'aikata. So idan mutum ba lafiya ba zai iya yi tafiya ba. Akan doka gadau ne sai a sa a daura a sa shi mutum a sama sai mu yi kaya mu sauko da shi.
Finally, it's time to go. With few handshakes and good wishes, we leave with a nice chicken as a token of the African hospitality to honored guests. The way down is as fascinating as the way up, though much easier on the visitors. It's a reminder that there is more to life than the hustle and bustle of the very racy urban existence. A trip to the countryside will always draw us closer to nature and reveal the wonders of the master creator.
That view from the top, breathtaking. We all need to experience a bit of that sometimes, step away from the hustle and bustle of the city and take in the beauty of God's creation. God is definitely the master artist, uncontested. And to my village producer, 3 gusas coming up. I knew you'd make it, even when you weren't certain. Well done. Now, there's more to come when you were there, so stay with us.
I'm a medical doctor. I'm a general practitioner as well. I see this as a means of reaching out to the lost, to the needy, to the poor, especially as we're in a rural area like this. There are a lot of poor and needy ones that may not be able to afford going to hospitals.
There's no way I can be in a hospital and reach about 200 people. It's not possible in 5 days for me to see 200 people with different kind of cases. It's just not possible. But with CBN, I've been able to do that. I've learned more, been able to improvise, done more of tropical medicine, more than what one would have expected anywhere. And above all, I've seen lives being changed.
I'm an optometrist, and basically we are to manage eye conditions. I didn't come here because of any, in quotes, any benefit I'm going to get from it. I just came because I felt it's time I should do something to society.
I want to encourage those undergoing training, male and female, whoever you may be, as long as you're in the medical field, doctors, nurses, you are needed here because there are a lot of people to be reached. And the more we are, the more people we can cover.
Everybody from every sphere of life should use their skills to serve God by reaching out to people.
I want to say a big thank you to the organizers for creating this kind of platform for us to be able to reach out to the lost, because on our own we may not be able to reach out to so many, especially in this setting. But with this kind of platform, we can reach out to them effortlessly.
Thank God for the level of cooperation we have received from our volunteers. They have really shown love and commitment to this cause.
It's been a fulfilling 5 days of medical outreach. All these life-changing stories wouldn't have been possible without the support of our partners. A big thank you to every CBN partner and to the Equa College of Health Technology, Kagoro. Your contribution is invaluable. Up next, we get some FaceTime with Mr. Maurice Dagwa, Provost of the Equa College of Health Technology, Kagoro. He tells us more about the impact of the CBN medical outreach.
We are able to record at least more than 4,000 for today. We could learn that a woman that had fibroid, which we know that ordinarily for her to have this treatment in Abuja or any other state, it may cost her 300 to 500,000. But here she was able to have that operation done on her free. 700 Club have provided enough in the aspect of the surgical cases we have. None of the cases have been turned down. We also have students, they complemented the aspect of this treatment. It's an opportunity for them to learn more and be able to see things for themselves.
The doctors actually did well for the students. We get to discover that most of the signs and symptoms of malaria and typhoid come similar. We hardly, as a community health student, we hardly get to differentiate these signs and symptoms. But we are privileged enough for the doctors to expatiate, to differentiate the signs and symptoms of this disease condition.
Most especially in the consultation room, there are a lot of conditions. So we're able to see it live and then see how the doctor takes care of the people and how the doctor comes to conclusion from the physical examination, the diagnosis, and then to the point of giving them drugs.
It has been a very wonderful outreach because it has come at the right time, at the time that people's needs were met. And they are saying, we thank God. We could see the joy in many of them that we are happy that at least they were able to have access to these healthcare services.
The cold and the rain did not deter the CBN team from paying a courtesy visit to the Chief's Palace in Kagoro, Kaduna State. The team has been received with so much excitement and joy. A makeshift medical center was created here to attend to the chiefs and the other pastors here in the palace. So far, the people have been grateful for these kind gestures that have been brought to their doorstep. But in the meantime, let's find out what's happening in there.
I'm Reverend Likita Musa. I work here in Kagoro. I have assessed my eye for a better vision. I came together with my wife, who is diabetic and has also been diagnosed and been given drugs. So we thank God for the services we have here.
I welcome all of you to Kagoro, and we're glad that you got to know about Kagoro and you thought you should come and help our people. And the number of people that, who are here, you treated, is wonderful. I was thinking it would not be as much as that. So we thank you very much. We thank CBN, and we hope CBN will continue to do this, not only to Kagoro, but other parts of this area. We are happy for what they have done for us. And you people that came safely, and we will go back safely. That is our prayer. Thank you very much.
The CBN's Operation Blessing medical outreach to Kagoro lasted for 5 days. 3,774 people benefited from the intervention. There were 188 general surgeries, 15 cataract surgeries, 160 dental extractions, 336 people received reading glasses, and many others received general consultations, lab investigations, and drugs, all courtesy of the generous support of CBN partners.
3,774 people got the medical help they needed because you chose to go to a remote community in Kaduna State. You could have held back what you had, and we would have left 3,774 people in pain. Thank you for choosing to save lives. Now, that's just one community. Imagine the number of communities like Kagoro with thousands of residents crying out for help. You can be their answer to prayer. Partner with CBN today.
Hello there. My name is Patrick Otaro, and I partner with CBN. The Christian Broadcasting Network is a humanitarian organization that brings living water and healthcare to communities, as well as loving care and shelter to orphans. Also, economic empowerment to widows. Join me today as we bring succor to our nation, Nigeria, and indeed, the world. God bless you.
Children danced for joy. You were there when the doctors came and saved their little boy. You were there to speak the truth, send the gospel near and far. You were there to change their lives right from where you are.
Thank you, CBN partners, for making a difference around the world. Your gift of love has changed life and eternity for millions.
When hurting hearts reach out and cry, does anybody care? You were the one who brought the gift. Thank God that you were there.
And it's a wrap. The show is over, but your life of impact is just beginning. Make each day count, and I'll see you next week.